Imagine waking up and scratching under your arm, but noticing a little something. You think it's a little nothing, but the doctor says it's a big something, the big C. That's what happened to my next guest, Dana.
I was 27 at the time. I was healthy. I didn't understand what having breast cancer meant and what that was really going to mean for the rest of my life. It was horribly surreal. My family and friends, we were just completely shocked. The good news is that we caught it very early. I attacked my treatment and my cancer like a bull. I decided to do a double mastectomy because of the aggressive nature of my cancer.
This was the day of surgery, day of the mastectomy. I don't know why I let you guys take any pictures of me.
As soon as I healed after my surgery, I was immediately into my chemotherapy regime. I knew that I was going to be in and out of the office a lot. I sat down in a room full of coworkers who are all women, and I just had to tell them that, you know, I was diagnosed with breast cancer. My company that I worked for was extremely supportive. They were really there for me throughout the entire treatment and allowed me to leave for my tests and come back or work from home. When I was able to go to work, I was able to forget about my cancer for just a moment and continue on with this life I had before cancer, which was a big deal to me. I've come out the other end, and it's made me a better person. I'm sitting here 5 years out, feeling good. Running a business is crazy to me because I wasn't sure I would get here.
Well, Dana is here with us, and also joining us is our good friend, Dr. Freda Lewis Hall, Chief Medical Officer of Pfizer. We just love having you here, so welcome back to the show.
I love being here.
So, Dana, I'm glad you're here. One of the things you had to go through, and having worked with the oncology population a lot in my career when I was in practice, people say they often deal with awkwardness about it because people don't know, do they bring it up? Do they not bring it up? What do they say? People felt awkward around you, right?
Yeah, I don't know if people know what to say. I've heard many things of, you know, oh, I'm so sorry, honey, you're just so young. And even weirder things of, oh, I'm so sorry, you know, my aunt or whoever had breast cancer and she didn't make it. And to hear something like that from, you know, a friend or a stranger is really difficult when you've just been diagnosed.
Yeah, and people don't know.
People don't. I mean, what do you say when you receive news like this, especially in a workplace, for example, where it's not close friends and family? It's so awkward, and everyone wants to be helpful. We were talking earlier. So many people have challenges with this that there's information out there that's available, like on cancerandcareers.org. There are great tips on how do you figure out saying something that is authentic, heartfelt, helpful, and not hurtful. So what to say and maybe mostly what not to say. Yeah. There was a recent survey on just that. It was commissioned by Pfizer and an organization that I just mentioned, Cancer and Careers. And in that survey, 77% of working women that were surveyed with breast cancer said that they found work to really help support their recovery. And as it turns out, that view is often held as well by healthcare professionals. Mm-hmm. Now, you had a great experience with your employer, supportive, engaging, kind of worked with you on that. There was another survey that was done recently, and the news wasn't quite so good. This was in women with metastatic breast cancer. And in that survey, 50% of women left their jobs after their cancer diagnosis. Half of those were involuntary. And 20% more felt that they had experienced some job-related discrimination.
And balancing treatment with your job is also important, right? You've got to find some way to do one and get it to jive with the other, and it's not always easy.
Right, well, and I'm really glad that you put it that way because it's not one or the other. I mean, what you want to do is to figure out how you can do both, how you can have the best support for your health and how you can thrive in the workplace. And there are lots of things that you can do to do that. First of all, a really good conversation with your doctor or healthcare provider to find out what does my diagnosis and treatment mean to my work, and what might my work mean to my diagnosis and my treatment? With that information in hand, you want to do some more investigation. You want to find out what kinds of resources and programs might be available with your employer, with the government, with other work communities that you belong to or are a part of. How those things then fit together is important because you want a plan that you can implement with your employer, with your healthcare team, with your family, friends, and the rest of your support network, and then be able to move that forward. Again, to thrive in the workplace, but to also have the best outcome. Anyone with questions or wanting more information or links to resources can go to gethealthystayhealthy.com.
Yeah. And when you go to gethealthystayhealthy.com and you click on this, discussing cancer with your doctor and working out a plan, you've got to be active in managing your disease, right? You just don't become passive. You stay active with it.
Yeah, you have to. I mean, I lived day to day by a calendar for that entire year of my life.
Well, Doctor, you're right. It's all about planning. And this is so important. We are going to continue this conversation tonight, starting at 9 p.m. Eastern, 6 p.m. Pacific time on Twitter. So follow me at Dr. Phil, and you can search hashtag cancer and careers to join us. And right up until that time, be on gethealthystayhealthy.com. You can look at the points that are there. It'll kind of tell you what we're going to be talking about over on that conversation. So I want to thank all of my guests today, especially our longtime good friend, Dr. Freda Lewis Hall. Dana, we thank you for being here, and congratulations on 5 years clean and clear.